COVID-19 was declared a pandemic by WHO on 11th of March 2020. As of 23rd of February year 2021, more than 100 million people have been infected by COVID-19 and around 2 million deaths have been reported globally. In Malaysia, there are a few challenges we face in monitoring the COVID-19 pandemic. For instance, it is a novel infectious disease. There is no baseline data as references. The case trends are fluctuating and uncertain, and this explosive disease spread requires daily monitoring. Thus, there is a need for sensitive monitoring indicators at the national and state level. To overcome these challenges, there is a need for innovation. So first of all is to identify a suitable epidemiological indicator, which the effective reproduction number RT are appropriate indicators to monitor the COVID-19 pandemic due to its ability to provide sensitive values on the current disease transmissibility and the progression of the pandemic. Second of all is to produce daily Malaysia-specific COVID-19 RT numbers. Developing a statistical algorithm that uses the serial interval method with locally tested parameters to generate the daily COVID-19 RT numbers at a national and state levels. Third of all is to validate the daily COVID-19 RT numbers. Here, two-stage validation, first using SEIR model built on the Bayesian inferential framework, and second using the SIR model built on the R software Odin interface. And finally, to disseminate the COVID-19 RT numbers to stakeholders by developing the MyR-Number Web Application and integrating with mobile and web portals. Further explanation on the novelty and application of the MyR-Number Web Application will be detailed out by my colleague Dr. Saban.
The first step of our project was to identify a suitable epidemiological indicator to monitor the COVID-19 pandemic in Malaysia. Here, we used reproduction numbers. Reproduction numbers reflects the infectious potential of a disease. Basic reproduction number, or R0, is the number of secondary infections generated from an initial case at the beginning of an epidemic, while effective reproduction number, or RT, represents the changes in infectious potential over time and is defined as the average number of secondary cases per primary case at a particular time. RT can be measured at different time points, in which if the RT is more than 1, this indicates the number of cases will increase, and if RTs are less than 1, it indicates number of cases will decline. Evidence from literature have shown that RT are effective indicators in monitoring infectious disease and have shown to be useful for the monitoring of the COVID-19 pandemic. Many countries globally have used RT as an effective metrics to monitor and manage the COVID-19 pandemic. The second step involved producing daily Malaysian-specific COVID-19 RT numbers. To do this, we developed a novel statistical algorithm using locally validated parameters that was developed using the serial interval method to estimate these daily COVID-19 RT numbers at a national and state level. The RT estimates was produced using case incidence distributed at a serial interval, which represent the relative likelihood of a disease transmission in time, given by the equation below. Validated parameters including case incidence, prior distribution mean, standard deviation, and a 7-day serial interval were computed in the algorithm. The generated RT values were then tested and confirmed using current and simulated COVID-19 disease trends in Malaysia by using appropriate parameter values. After producing daily COVID-19 RT numbers using the statistical algorithm, the national RT trends were validated in 2 stages during the second and third COVID-19 waves in Malaysia. The stage 1 validation was carried out using the modified SEIR model built on the Bayesian inferential framework. Here, we found a high correlation during the second and third waves, whereby the Pearson's correlation ranged from 0.82 to 0.91, whereby a Pearson's correlation of 1 indicates a perfect correlation. The stage 2 validation was carried out using the SIR model built on the R software Odin interface. Here we found the RT generated an accurate fit of case trends in the model. Both validation stages produced highly correlated results and confirmed the accuracy of the RT numbers generated by the statistical algorithm. After developing a validated statistical algorithm that is able to produce daily COVID-19 RT numbers at a national and a state level, the next step is to disseminate the COVID-19 RT numbers to stakeholders. This was done by developing the MyR-Number Web Application system, as a system which uses the validated statistical algorithm as a backend for the application that was developed using the R programming software with the Incidence, XTS, Shiny and Yesunite packages. Interactive real-time continuous daily RT numbers were generated within 1 hour from the availability of daily case incidents reported on the Ministry of Health web portal. This application allows for interactive interface for manual RT calculation and adjustments to input parameters as well. To ensure the system produced continuous daily RT outputs, we had taken several measures. First, to prevent downtime, we had introduced redundancy through hosting the application on a cloud-based server and a backup local server. Second, we ensured access to COVID-19 case incidents and parameter value data were from multiple open access data sources by incorporating a manual override as a fail-safe mechanism. And third, automation process can be overridden manually in the events of automation failure. This is the MyR-Number Web Application system. Upon logging into the system, users will be able to get access to a list of options in the left side of the panel. Upon selecting the visualization option, users will be immediately able to get access to the current RT estimates for the day, and they are able to visualize the RT estimates along with their 95% confidence interval using an interactive plot at a national level as well as at a state level. Furthermore, these interactive plots enable users to zoom into a desired period of time to visualize the RT trends in a more detailed manner. The output of the system are available in a tabular format as well. In this table, the daily RT estimates along with the lower and upper confidence interval are displayed and can be downloaded in a CSV, Excel and PDF format. Under the data section, users are able to manually input the daily case counts to generate the RT estimates manually. The MyR-Number Web Application system has several important utilization. The daily RT numbers generated from this system has been integrated into the MySejahtera mobile application and the Ministry of Health COVID-19 website. In addition, this system also provides access to daily COVID-19 RT numbers to official channel, prints and social media such as Facebook. These measures increases the public awareness and accessibility to the daily COVID-19 RT numbers in Malaysia. This system has been utilized to generate daily COVID-19 RT reports. These reports are disseminated to national and state level CPRC, which helps in the monitoring of the COVID-19 pandemic situation in Malaysia. Additionally, the MyR-Number Web Application system is also able to accurately forecast case trends as observed during the second and third waves of COVID-19 in Malaysia. Most importantly, the MyR-Number Web Application system has assisted in the major decisions for the control of the COVID-19 pandemic in Malaysia. For example, the outputs generated by this system has assisted the government in instituting various control measures such as the Movement Control Order to control the COVID-19 pandemic in Malaysia. To summarize our work, due to the existing challenges in monitoring the COVID-19 pandemic, we have identified a suitable epidemiological indicator for monitoring the COVID-19 pandemic in Malaysia using the effective reproduction number. Subsequently, we developed a statistical algorithm that is able to produce daily COVID-19 RT numbers at the national and state levels. After this, a two-stage validation of the daily COVID-19 RT numbers was conducted using the SEIR model built on the Bayesian inferential framework and the SIR model built on the R software Odin interface. Finally, we developed the MyR-Number Web Application system, which is an automated system that is able to produce continuous, daily, validated COVID-19 RT numbers at a national and a state level, which has been helpful in disseminating the RT numbers to stakeholders. Several manuscripts have been published as a result of this innovation in international journals. These manuscripts detail out the methodology used, the validation process, as well as the output results of this innovation. And these are the list of the project members that had contributed in developing this innovation. Thank you.